So I'm going to be presenting on cleft palate. So after this presentation, hopefully you'll be able to understand how cleft palate develops, as well as what groups could be more at risk. You should be able to understand both the symptoms and different treatment options for cleft palate. You should be able to understand and know what tissues and parts of the palate are affected by clefting. And overall, you should be able to understand the disease and how to better help support your child with cleft palate. So what exactly is cleft palate? It is a very common developmental disorder where the roof of a child's mouth or palate does not completely fuse or join together. This results in a hole in the roof of the mouth, and this hole is between the nose and the mouth. Oh, and cleft lip, sorry, is the hole between the nose and the mouth. But this presentation will be mainly focusing on cleft palate. And this occurs normally between the 16th and 13th week of pregnancy when the bones of the jaw, nose, and mouth begin to form together. And this image, you can kind of see what cleft palate, where that hole in the roof of the mouth, what that looks like. And again, here is another image just showing the hard and the soft palate. The hard palate is more towards the front of your mouth where your teeth are, and the soft palate is more towards the back of your mouth where your throat is, but the cleft is that hole that's in that roof of the mouth. So who is affected? Anyone can develop cleft lip and palate. However, the groups listed below have an increased risk. So that could be a family history of cleft palate, certain ethnicities, genders, and certain environmental factors can all play a role in the increased risk you have of developing or your children developing cleft palate. So family history, 1 out of every 5 cases is inherited. That is around 17 to 35% of all cases coming from a positive family history. It is inherited in an autosomal dominant fashion. This just meaning that one parent can pass it on to their children. And this image on the right-hand side kind of shows like an affected father who has one mutated gene can pass it on to 50% of his children. And then an unaffected mother doesn't matter because the father has that one mutated gene that can be passed on to the offspring. But there are 2 types of cleft palate. There is syndromic, which is caused by specific genetic or chromosomal mutations. And then there's non-syndromic, which is caused by a combination of genetic factors and their interaction and behavior with the environment. And then this image is kind of just breaking down syndromic and non-syndromic, showing that non-syndromic is more common, and that can be due to hereditary or non-hereditary, which is a sporadic fashion. And then on the right-hand side, this is basically more for cleft lip, whether that be a unilateral or a bilateral, and that just depends on where the hole is. Ethnicity and gender, on average, people from Asian and Native American and Hispanic descent have higher rates of developing cleft palate, so they have like a 1 in 500 chance. African Americans, however, have lower rates of incidence on average with a 1 in 2,500 rate, or 2,500. And males have higher rates of developing cleft lip with a male to female ratio of 1.5 to 1, whereas females have higher rates of developing cleft palate with a male to female ratio of 0.72 to 1. And researchers at this time still don't know why males have higher rates of developing cleft lip as compared to cleft palate. So an example, there is a multitude of environmental factors, but this could be pregnant women who smoke or drink, if pregnant women have a folic acid deficiency, it could be overexposure to things like corticosteroids, if you have diabetes, if you're obese while pregnant. Also, in a lot of developing countries, malnutrition is one of the reasons why you see higher rates of cleft palate. So symptoms your child might experience. With cleft palate, obviously, having the hole in the roof of the mouth is the biggest symptom that you see, but they also experience difficulty eating, difficulty breathing. There's a lot of speech and language delays, as well as you might see a lot of chronic ear infections and other dental related issues. So, the formation of the palate, as I mentioned earlier, the palate develops between the 6th and 13th week of gestation. There are two parts of the palate. There's the primary palate, which is kind of shown in the yellow, and then there's the secondary palate, which is shown in the orange on this figure. And the frontal nasal prominence will grow to become what is known as our forehead, nose, and a portion of our upper lip. And it's basically known as the primary palate. And then the left and right maxillary prominences will grow to become the lower face, lip, and jaw. And then this is just kind of an image showing um, the different segments and prominences, as well as the primary palette, which is in red, and the secondary palette, which is in yellow. So continuing on, the frontal nasal prominence and the left and right maxillary prominences, these three prominences will start to grow and come together during this time to create the full mouth, nose, and lips. It is located next to these prominences are things called palatal shelves. These palatal shelves are wedge-shaped tissues that are made up of mesenchyme for our neuronal crest and our oral epithelium. And then this image just kind of shows the primary palate and the secondary palate and it fusing together. And then they start all on the sides of our mouths, these palates, and as the fetus grows, these ledges will begin to lengthen and join together to form the back of our palate. And these palatal shelves will also join together with the nasal septum, which eventually forms our secondary palate. And then this is what separates the formation of that secondary palate, is what separates our nasal and oral cavities, basically closing off the roof of our mouth. And then how does cleft palate actually form? So it'll form if there is any disruption in the growing and fusing of the nose, mouth, and palate at any time during its development. There's many genes and environmental factors that can play a role at different times of palatal formation. But the primary cause of cleft palate is due to a disruption in the fusion of the secondary palate, which causes the opening in the roof of the mouth, whereas cleft lip, which is the opening or gap in the lip, is mainly due to a disruption of the primary palate formation. And then this image just kind of shows normal palates, unique lateral clefts, secondary palate, and it gives a good image of all the different types of palates you could see. So treatment, surgery is the main option. This is what really fixes the cleft palate. A lot of the times, though, later on in your child's more adolescent life, you will see things like palate expanders or braces, as well as speech and other therapies your child might have to go through. But the surgery, so it's usually done around the 12-month mark. Its goal is to close the opening in the roof of the child's mouth, which will allow for normal speech, swallowing, and feeding. It's a pretty complex surgical procedure, but essentially, it is taking the tissues and muscles around where the hole is and attaching them to the bone of the hard palate. Incisions along the gum are also cut to allow tissues to stretch, and once it's stitched up, it will resemble a Z shape. This formation, scientists and doctors and researchers have seen that it allows for improved speech and faster healing. And then this is kind of an image of where the cuts are made, kind of along the gums and the palate, and then where they are being stitched up in that Z formation. And this is kind of just an image of one that isn't in a Z formation, but they've kind of just loosened up some of the tissue and stitched it in. And then these are my references as well as all of my image references.